Description from Mrs. Smith.
That's me.
What's top line of the address, please?
It's 55 Hawthorne Drive.
Okay, so you've got new medication here, I do believe.
Yes.
Yeah. So it's called Warfarin. Do you know much about it?
The doctor briefly mentioned something about it, about because it's my heart, something to do with my heart. But he didn't go into too much detail, so I wouldn't really know exactly what it's for.
So you want me to tell you a few things about it?
That'd be fantastic. Yes, please.
So do you know what condition it is for your heart by any chance? I understand it might be something called atrial fibrillation. That rings a bell.
That definitely does ring a bell. Yes.
So the problem with atrial fibrillation is basically because the heart isn't pumping quite as it should do, you can get blood clots. Now blood clots aren't a bad thing, but in conditions like that, it clots a bit too much. So we just need to put medication in there to perhaps stop it clotting as much as it should do. Because if we don't, it can block sort of blood vessels, and so that can lead to strokes, DVTs. But don't worry, because this medication is really effective at stopping those. So we're going to give you, obviously the doctor's prescribing you this, and we shouldn't have any problems with that. It's just really important that we sort of take it properly and we watch out for side effects. So that's what I'm really going to sort of try and talk to you about. So you're going to be on for regular blood tests. Did the doctor mention this to you?
He did. He said something about this reading that I have to get.
Okay. Yeah, so that's called the INR, and that just is basically used to see if we're giving you too much warfarin or we're giving you not enough. And basically, we're aiming to give you what they call an INR of between 2 and 3, and your dosage will be regularly changed to sort of will be adjusted regularly to sort of make sure we're within that range. So if we're giving you too much and the INR is too high, we're going to reduce it, and this could change every sort of 2 weeks or 3 weeks or 4 weeks. Depends on how well you're getting on with it, but we should get you steady on it eventually, so it shouldn't be too confusing. Okay. It's also, did they tell you about what timing to take it? Is it like 6 PM or anything like that? Because a lot of people...
He said something about once a day. I can't remember if he told me exactly the time to take it, but
alright, but just if you...
I'm not sure.
Yeah, just try and take it exactly the same time every day.
Okay.
If you're given a specific time, take it then. And if you've got a smartphone or something like that, it might be an idea to set an alarm on there and see if you can sort of set a reminder so you don't forget to take it.
Okay.
Okay, if you do forget to take it, just make a note. I'm going to give you a book at the end, and it's got a sort of diary of how you've taken it. If you do forget to take a dose, just make a note of it and repeat the dose. Don't take that day's dose and just carry on the next day as normal. So say you missed the dose today, don't take another one today, just carry on 6 PM tomorrow, say you take it then. Don't double the dose or reduce the dose or anything like that unless you contact the prescriber and they tell you to do that. Does that make sense to you?
It does, yes, because I remember the doctor saying something about if I miss the dose to say to the nurse or say to him when I'm getting my blood reading. So yeah,
that's good. Just a few side effects you need to watch out for.
Okay.
So obviously bleeding can be a problem if we give you too much warfarin or the dosage isn't quite right. So just watch out for any sort of unusual bleeding. So if you've got bleeding gums all of a sudden, or you find there's blood in the urine, blood when you go to the toilet for a nosebleed or blood in the vomit, anything like that, just report that. And also if you get a severe headache or there's actually red blood coming out, you're coughing up, you can't stop it, or there's red blood coming out there when you go to the toilet and you just can't stop it, call 999 because that could be a serious sign that you're bleeding too much and that needs to be addressed. So like I said, whenever you go for NHS treatment or any other private treatment or whatnot, you're going to be given a sort of a warfarin card. And you need to show this to whoever it is, so let's say it's a dentist or the pharmacist when you go for like over-the-counter medication. Just show them that so they know that you're on it. So because some things can be complicated if you're on it, and we all need to know. We don't want to sort of complicate the treatments. All right. And so also, just want a quick note: do you drink alcohol at all?
I do have the odd glass of sherry in the evening sometimes, but it won't be that often. Maybe 2 or 3 times a week.
Yeah, maybe try and cut it down to 1 or 2 times a week because alcohol does interfere with warfarin. If you can cut back at all, that would be beneficial for you. But that doesn't sound like too much anyway. So
yeah, I do enjoy the odd glass the odd evening. Yeah.
So it's not. So also it's important to avoid, well not avoid, but reduce the intake of certain foods.
Okay. So
if you're eating much sort of green leafy vegetables, things like spinach, those are something to cut back down on, as well as liver, because those foods are rich in vitamin K, which we don't want when we're taking warfarin.
Okay.
And also, just a quick note, it's really important to avoid cranberry juice.
Oh, I don't like that stuff anyway, so there's no doubt of me drinking that.
That's good. It just avoids certain over-the-counter medications that might be for cystitis because they've got that in it.
Okay.
Okay. Have you got any other questions at all?
I think that's everything, yeah. So just make sure to take it every single day at the same time
as
each
directed.
day. Okay, that's
And
fine.
return the regular monitoring, and you know the side effects to watch out for.
Yes.
Yeah, so I'm just going to give you the Warfarin book now.
Okay.
We've got lots of information. It's just you record how much you take and when you take it, and also just show it every time you go to the clinic or to the healthcare professionals. Is that okay?
That's great. Thank you
Alright,
very
thanks.
much for
Have a nice
your help.
day. Bye.
You too.